welcome to everyone that's online and in person. We are here to talk about opioid overdose and how to prevent it. And my name's Bonnie, and I'm here with Mikkel. We work at Utah County at the Health Department, and so we're really happy to be here, and we're happy that you were able to come in person or that you're able to join us live. Opioids are a very serious issue, and it's something that we all should be aware of, right? And an overdose can happen to anyone. Anyone that's taking opioids can experience an overdose. And so hopefully by the end of this presentation, you will be able to recognize the risk factors for an opioid overdose. You will be able to know how to respond to an overdose. And then also we're going to talk about Naloxone and how to administer it. And then we'll talk about some resources as well. So as we go through this, if you have questions, feel free to ask your questions. You can ask online in the chat, and Darlene will let us know if there are any questions there, or you guys are free to just ask your questions. So let's get started here. What is an overdose? Does anybody want to answer that question? What is an overdose?
Basically, someone's taking more than what they're supposed to take.
Yep. It's when you take too much of anything, right? Could be considered an overdose. So it's a toxic amount that overwhelms the body. So when we take too much of anything, it can be dangerous, right? Even something like coffee. If you drink too much coffee, you know your heartbeat can accelerate and it can be dangerous. And some overdoses can be lethal, like we know, such as alcohol or cocaine, or speed or heroin. That can be lethal. But today we're going to talk specifically about opioid overdose. So this is kind of interesting, and this we're going to talk about all the risk factors for overdose. And as we go through these, feel free to comment on what maybe reasons why you think this might be a risk factor. So remember, a risk factor is something that might make someone more likely to overdose. So the first one that we're going to talk about is dependence. So dependence happens, as we take a drug into our bodies, you can become dependent on it. And opioids are especially difficult because you can become dependent on an opioid in as little as 7 days, which is not very much time. You may be following exactly your doctor's instructions and you can still become addicted. And so that's why that's a risk factor. The next one is tolerance. Does somebody want to explain what tolerance means? Or just when you think about it? Mikkel wants to explain.
I want to explain. So I think of tolerance, I think of it as something like, okay, let's say a person's taking a lot of something. Where does their tolerance go? Up. It goes up. If someone's not taking it anymore, where does their tolerance go? Down. So if someone, let's say someone was taking opioids for a long period of time, their tolerance is up here, and then they stop taking after a while, their tolerance is going to drop. And so the thing that we see happen is if someone is going to use again, let's say they broke their back or something, and they remembered what they were using before, and they try to use that same amount, their tolerance isn't as high as it was before. It's down here now. So their likelihood of overdosing is, their risk goes up a lot for overdosing. Does that make sense? That's what tolerance is.
That's a perfect explanation. Perfect. So once your body becomes tolerant, you would require, over time, you require more of the drug, right? But then, let's say you're in rehab or whatever, and so you're off of it, and then if you use again, you have to use a smaller amount. You can't go back to what you were using before. So exactly like what Mikkel said. Good. The next one, if you have high doses of prescription opioids. So if you're prescribed a lot, and maybe you took one and you forgot, and so you take another one, you could be at a higher risk for overdose. Injecting drugs, if you're injecting drugs, so if you're injecting heroin, you're at a higher risk for overdose because you may not know exactly what is in there. It could have fentanyl mixed in, other street drugs, so that's a risk as well. Mixing drugs is also dangerous, we know. A lot of times in the coroner's report, they found that most people who have died of an overdose have a mix of drugs in their system. It's not always just one drug, it can be a mix of drugs. Or for example, alcohol could be mixed with opioids, or opioids and cocaine could be mixed. So mixing drugs is also a risk factor. And then something we might not think of, but poor physical health could also be considered a risk factor. So if you are dehydrated, or you have poor liver function, or you have asthma or sleep apnea or COPD, these different, your body might not be able to tolerate an opioid as well. And so that, you might not be able to cope as well with the side effects. And so that's another risk factor. And then the last one that we have here is using alone. If even if you're on regular pain medication and no one is aware that you're using it and you're using it by yourself, you are at risk because no one is there to help you if you overdose, right? So using alone is dangerous. So let's talk a little bit more about what is an opioid. We have some pictures up here. You can see there's different varieties. There's naturally grown and synthetically made, but they're still considered opioids. Opiates are made from the opium plant, that's a picture of the opium plant there on the side.
Poppy plant? Has anybody had a poppy seed muffin?
Oh,
The same plant, technically.
That's not happy. I'd rather eat one.
Yeah, so that's what the plant looks like there. But they can also be synthetically made. And then our bodies react to them. The reaction in our body, it reduces pain, but it also slows down the body. And one of the most important reactions is it may stop breathing. It slows down so much that you stop breathing. And so it's just important to be aware of that. This next slide shows pictures of common opioids. So you'll see up here we have Oxycontin, Percocet, Lortab, which those are usually prescribed for pain. And then we have morphine down there on the left, which it's an opioid that's used in surgery. And then we have fentanyl there, which fentanyl is also used for pain, but fentanyl, keep in mind, is 50 to 100% or 100 times more potent than morphine. So very little fentanyl can cause an overdose. We've heard stories of even law enforcement officers that have been working with fentanyl, and so it can be really dangerous. So just be aware of that. And then also heroin. Oh, and one other thing about fentanyl, it's mass produced in China and it's illegally sold here. And so it can be purchased at a low cost and is often mixed with heroin, which can lead to overdoses. So keep that in mind. And then of course, heroin is also an opioid. So what is not an opioid? The list includes crack cocaine, ecstasy, marijuana, bath salts, and meth. Those are all not considered opioids. Okay, so let's look at this next slide. It shows overdose deaths in Utah, starting from 1999, and you can see every single county in the state. This shows just through 2016, but every single county shows an increase in opioid deaths. This is per 100,000 in the population, and so it's definitely a problem that has increased over time. And a lot of this can be attributed to just the access that we've had to opioids and doctors prescribing them. I do think a lot of education has been done, and so more and more people are more aware of the dangers of opioids, and we'll talk a little bit more about that too. So what is the solution to this problem? Sometimes it feels overwhelming, what can we even do? How can we combat this? But there are lots of things we can do, and one thing that we work on at the health department is community education. There are several awareness campaigns that are out there, and this one is a really good one. Don't add addiction to injury. Not all fails need opioids. And this website, useonlyasdirected.org, has some great information. One of their main campaigns is called Speak Out, Opt Out, Throw Out, and it's really, the point of this is to talk to your doctor and ask about alternatives. Speak to your doctor, and then opt out of taking that opioid medication. Maybe instead of taking opioids, you can, a lot of times in our world, we want a quick fix, right? We want to take a pill and have everything feel better. And we want the pain to stop right now. And so some alternatives might take longer, but one message that we put out is to meditate before you medicate. Maybe you can do yoga. Maybe you can ask for Tylenol or ibuprofen as an alternative. Just try to see what you can get by with to use an alternative to opioids. And then throw out is a big part of our message. So and sometimes I think we're here in Utah and we like to stockpile and have our year's supply, and we feel like we need to hold on to these medications.
Yeah, in case of a pandemic or something.
Yes, in case of a pandemic. But that is not the case with opioids. You want to get them out of your medicine cabinet. We found a lot of youth access opioids through their relatives' medicine cabinets. And not just youth, I guess really anybody could access that. And so that's a big part of what we do, is to push these drop box locations. And this is an example here of a medication drop box. And actually in your folder, there's a flyer that shows all of the drop box locations in Utah County. And the awesome thing about these locations is it's free, it doesn't cost anything. You can just drive up, drop it off, no questions asked, and they will get rid of your medication. Also, we do drug take-backs events. Oh, Michael's showing what it looks like right there. We do drug take-back events where you can bring back your older unused medication and they'll destroy it. And then also there's this product, it's called DisposeRx, which let me just show you what it looks like. It's just these little packets here like this, and it's got a powder in it. So you can take this, you take your pills, your old medication, and you take this powder, you add it to your pill, and then to your pills, and then you fill this with water and you shake it up, and it turns into a gel-like substance, and it makes it so that you cannot, it's unusable. And also this is environmentally friendly, so you can just then throw it away. You probably know this, but you don't necessarily want to flush your pills down the toilet. A lot of people do that to get rid of it, but that's not safe for our water system, so we don't recommend doing that.
Well, now, can't they, even if it's got gel stuff, can't they get it out and cut it up and still get the tablets out, whoever finds it?
Gosh, I hope they would not do that.
If they're desperate enough though.
Yeah, if someone was really desperate, they might do that. But this really renders it unusable. So, Mikkel, have you heard of that? Of people getting into this and like cutting up the gel and getting the tablets out?
No, so the way that the gel works is that it completely negates any of the drug effects. So, which makes it safe to throw away. So even if kids or animals or adults got into it, it won't do anything for them. I mean, obviously don't eat it in large quantities because that's probably not going to be healthy, but it shouldn't do anything. It makes it completely safe. And it's kind of a good alternative because before they were saying they wanted people to mix it in with the other option, if you don't have these, is to mix it with an undesirable substance. So like coffee grounds, old diapers, things like that.
Cat litter.
Yeah, cat litter. Mixing it up. But this is like a really easy, safe way. So that way it doesn't go into our landfill at all. Like it completely negates those drug effects. So it's safer that way.
Yeah, we just go down to police stations and say, go to
Yeah.
Yeah, that also is a great way. Yeah.
This kind of-
This one isn't as cost efficient as that one. That one's free. So
Yeah.
this one's a lot of people during COVID loved these because they didn't want to leave their houses at the time, and so
Gotcha.
they're like, or a lot of our elderly who are homebound prefer to use things like this.
Perfect. Okay, so let's talk about some overdose prevention tips, which this is something that I didn't really think about, but you want to have a prevention plan. So you want to know, or you want someone else to know, someone that you trust to know when, where, and how much you are taking of an opioid, so that they can be there for you at that time, and so that they can know, just so that they're aware and they can help you if needed. So have a plan in place. Start small. So start with a small amount, the smallest amount possible. I mean, I know a lot of women after they have babies are given, Percocet or whatever. And if you can start with the smallest dose possible, just to see if that will help, if you want the smallest amount possible that will still help you with your pain. So keep that in mind. And then also get an Naloxone kit, which is why you are here today, is to get a Naloxone kit, so that you can prevent an overdose if it happens. So, yeah.
And I just have a comment to talk about the prevention plan. So, like my grandma, when she was taking pain medication, like our family was really involved in when she was taking it, so that we could help her in case she forgot when she took her medication. And so there was a certain time of day that she would take it, and we would just go and check on her and say like, hey grandma, how are you doing? Like, did you take your medication? And we just be there to check on her. And this is something we work with a lot of like rehab, addiction rehab individuals, and even talking to them, it's like, if you know somebody who's struggling with addiction, it is hard. It is hard. And even having that safe person to go to that says like, hey friend, can you check on me in like half an hour? Just check on me and make sure I'm okay. Just having that safe person to know, because it's always good, and making sure that they know where you or they know where the Naloxone kit is as well. So just keeping in mind those kind of things as well.
Perfect. Just have a plan in place. Okay, we're going to try and show you this video.
You should be able to just click on it.
Okay, I'm just gonna click on this and we'll see if this video.
Pretty much just like any kid in junior high and stuff that wanted to fit in. Started drinking and stuff at a younger age at parties and stuff like that. Around 18, I got in a bullet bike accident and was prescribed OxyContin and became addicted to pain medication. My prescription ran out and I got sick, so I started doing heroin in turn to deal with the opiate withdrawals. I mixed benzos, which you're not supposed to do, with methadone, and I thought I just went to sleep. And when I woke up, all I remember is just seeing like 7 police officers standing around me, and my mom standing there like crying, saying that she had to administer Naloxone overdose kits just to get me to like stabilize to where before the ambulance got there. The first thought was that I knew I overdosed. Right then I knew instantly. And I could just tell like the look on my mom's, the first thing I thought of was that look on my mom's face, like that fear, like she just looked like she just saw a ghost. Everyone deserves a chance, and I think they deserve as much chances as it takes for them to get clean. I have many, many, many friends of mine that have died from overdoses that I wish I had an Naloxone kit. that I could have used.
Okay. So I really like that video. I just think it's so relatable. I mean, he had a surgery and then the opioids. I mean, it can happen to anyone. And so I just appreciate his message, and yeah, I thought that was a good message. So let's talk about naloxone. What is naloxone? Which is also can be known as Narcan, which is Narcan the brand name, and naloxone is the drug name. Okay.
Yes.
So if you've heard of naloxone or Narcan, they're the same thing. But naloxone reverses an overdose from opioids, and so it can reverse heroin or prescription opioids, like we talked about, including morphine and fentanyl. One question that we get a lot about naloxone is, can you get dependent on naloxone? And you cannot. There's no dependence on naloxone. There's no way you can abuse it, even if and I think Mikkel's going to talk about this more, but if you come across someone and you're not sure if they actually overdosed or not, it's not going to hurt them to administer naloxone to them. There's nothing, it won't hurt them.
You know if they wake up pretty fast that it was a drug overdose.
Yes.
It's amazing how fast this stuff acts.
Yes, it does act fast. The thing that you have to be aware of is that when they do wake up, they are going through withdrawal symptoms right there. And so some of those withdrawal symptoms may be agitation, anxiety, muscle aches, sweating, nausea, vomiting. Like, they can be very agitated when they wake up. So let's talk about how it works. This image shows the opioid receptors in the brain, and the opioid's sitting there, and the naloxone or the Narcan knocks the opioid off of the receptor and attaches to the receptor. And it works really fast, like you said, in 0 to 5 minutes it works. And it lasts about 30 to 90 minutes. So hopefully that's enough time for you to either get them to the hospital or have the emergency services come to them. So you may have to, overdose may reoccur, which sometimes we're not aware of that, but you may have to give them more than one dose of naloxone, depending on how quickly you can get them to help. And then we talked about this a little bit already, just the withdrawal symptoms that might occur when you administer naloxone. And apparently the most common one is aggression. People, they're mad when they wake up. I don't know. Do you know much about that?
Yeah, well, I mean, it's part of the withdrawal. Like, it's just like when someone overdoses, you're at the high of your life. You're the end of your life, and so coming down from that, and why do people take opioids? It's to get away from the pain. And so, have you ever been in so much pain and you have people standing around you and you don't know what's going on? Like, yeah, it's just very agitating, and sometimes people come out aggressive. Not everyone does, but it is common for that reason, just because of the pain, confusion.
Okay.
It's hard.
Okay, so just a trigger warning, we're going to show you the different types of naloxone, and there are needles that are shown on this next slide, so we just want to let you know that sometimes that bothers people. Let me just show you these. There are 4 different types of naloxone, and you can see them here on the screen. The intramuscular, a manual injection one, the auto injection, and then you have the nasal spray and the atomizer spray. So you have those 4 different kinds, and Mikkel is going to go into more detail about these, and specifically about the nasal spray Narcan, which is the kind that we have that we're going to give to you. So an important thing to remember is that naloxone needs to be stored at room temperature. We were talking to a man the other day, and he's like, "Oh, I'll just put it in my car, so he can have easy access to it." But really, that's not the best idea because it gets super hot and super cold in your car. So you want to keep it at room temperature, and they usually expire after a year. And all of these are equal in effectiveness. They're all equally effective, but they are not equal in price. The price can range depending on which one you get. Let's look at this slide, where to get naloxone. You can check out this website, naloxone.utah.gov, and you do not have to have a prescription. If you go to one of these pharmacies, you can get naloxone from any of the pharmacies that are on that list without a prescription. It's covered by most insurances. Sometimes you have to pay a copay of $25 to get it. And without insurance, the cost can range from $45 up to $4,000, which seems so crazy. But the one is super fancy type of naloxone. So anyway, we just want you to be aware of that. And then also we have free kits today, which is what we're gonna do today. So Mikkel's gonna take over, but are there any questions about anything we've talked about so far? This is kind of a good halfway point here. So I'm gonna pass it, go ahead.
So in the video, that gentleman mentioned, was it methadone? What did he mention he took? But that wasn't on your list. What is that related to?
I forgot what he said in the video. Methadone is kind of, I almost think of it as a mixture between we have methadone clinics for people who are going through rehab. It's a way to get off the opioid little by little instead of going cold turkey, because that is a very brutal experience for people who are trying to overcome that addiction. And so methadone is it's almost like a mixture between the opioid and the naloxone, where it kind of gives you a little bit of both and weans people off.
So
and it's safe, and we have methadone clinics here in Utah County that help people medically get off opioids, and they're very successful.
Yeah, so it's like a help.
But it can still be abused.
Yeah, I mean, obviously in that video, he had used it.
Yeah, the clinics that I was speaking of before are like, they have health professionals that give them the methadone and help them wean off. Okay, so good questions. And then let's see. Okay, awesome. We're going right into it. So we're going into responding to the overdose. And is it okay if I sit over here? Okay. I don't want to be in the way, but I kind of want to be close to you guys.
Do you want a chair?
I'll just take this chair right here. I like my little chair. So cute. And also, I just have all of my fun stuff over here. So.
Yeah, she's got lots of show and tell to show you.
Yeah, and just so you know, please take these when we're talking about the campaigns, the different campaigns that we have. So these are some like little emergency kits. They have ibuprofen and Tylenol. It's just part of the campaign of, hey, if it's possible, let's find the alternative. And then ice packs. Our youth love these. Our youth who are in sports, we talk about different ways to manage pain and to cope with pain. So like ice packs. We talked about yoga, meditation, and just different things for them. And then bringing your attention to the folders that you have. And sorry, online folks, you don't have access to this, but if you do want access, just let us know. We can leave any of these materials here for you to pick up. And we have, let's see, so in the folder, everything that we're going over today is on this page. So if you are a note taker like me and are constantly scribbling down, I saw some photos being taken, that is me too. Everything that we talk about, that Bonnie talked about, is on this first page. So if you have any questions, if you're trying to remember, what puts me at risk for an opioid overdose, we have the list here. And then if you're interested in looking at more of the campaigns that we talked about, the website's there. There's also how to find naloxone and how to find treatment services as well. And part of the treatment services, and I'll go over this more later as well, but we refer people to 211. It's a great resource for really anything. And so, yeah, there we go. And when we talk about access to naloxone too, I don't want to leave the Spanish Fork Library out, because congrats to the Spanish Fork community. You now have naloxone here for free, and the librarians here are trained. And so if you online aren't able to get naloxone from a pharmacy, or if it's hard, it can get expensive, and we'll talk a little bit about the prices. But if that's difficult, just come here to the library. And I believe that the librarians have the intramuscular kits, which we'll talk about. Those include a needle. Sometimes our community members don't feel comfortable with a needle, and so the ones that we have are the Narcan nasal spray, and that it's just a spray, no needle, and a lot of our community members feel more comfortable with that for obvious reasons. I don't feel comfortable using a needle, but they're all both of them are fairly easy to use though. So it's awesome that we have this here now, and so yeah. And with that, I'll go on and get started. So we talked about. I wanted to brush up on what Bonnie had said before about things that put us at risk, and he said it in the video as well. Mixing drugs. A lot of people don't realize that benzos are part of that mixture. We don't, and the reason being is that it's a type. The drug will depress your body, that central nervous system. So does anybody know what a benzo is? Benzos are taken for depression, anxiety, anxiety is something that calms that central nervous system. Alcohol, also a type of depressant. So it will, if people take too much alcohol, they get kind of sleepy. Opioids, kind of the same thing. It slows down that central nervous system, which can include breathing. And so when we think about the type of things that an opioid can do, like if we take them in any of those combinations, hopefully people don't try all three together. That can be a lethal combination. And so Bonnie would mention those opioids and what they can do. So if we think about it as depressing the central nervous system, what kind of things might we see? And I will step aside so that you can see the projector. So we're gonna go over the 5 R's, and the first R is recognizing the overdose. What does that look like? What does our emergency preparedness teach us? So first off, they won't wake up. Does anybody want to take a gander at some other risk or recognizable signs of an overdose?
They're not breathing, maybe.
They're not breathing, shallowed or stopped breathing. We talk about how that it slows down that central nervous system. So that includes breathing.
Which is interesting to note that one of the risk factors is if you have asthma or COPD.
Yeah.
Like that plays into this right here, what she's talking about.
Yeah. And usually when people are prescribed opioids, that's something that the doctor takes into consideration when they're prescribing to that person, which is why it's so important that we don't share our opioids with other people, because the doctor, even taking it as prescribed, as Bonnie said, like you can still form a dependence on it. And so when the doctor's talking to you, like they're thinking about all your medical history, your body type, your gender, all of those things, and that's why it's important to take when we're prescribed. So gurgling or choking noise, that some people know that as the death rattle, not pleasant. Small pinpoint pupil, this one's a little bit more unique for the opioid overdose. It's not going to help you if it's really bright in the room that you're in. So if it's bright day, you're outside, and you open their eyes, they're going to be pinpoint pupil anyway. So it's not going to be helpful, but if you're in a dark room and you open their eyes and they're that small size, that's a sign. So we talked about before that slowed or stopped breathing, so you're going to have that bluish, purplish tint in the fingernails and lips. and cold, clammy skin. And obviously, if there are drugs present, that is another sign that this might be an opioid overdose. All of these are recognizable signs for an opioid overdose, but they aren't necessarily unique. These similar signs, can anybody think of what might be similar to an opioid overdose?
Well, I know my daughter has POTS and her hands would turn blue and her feet would turn blue.
Yeah,
And she gets clammy skin, she gets white very
Yeah.
quickly.
there are other things that have these type of symptoms, which is why it's always important if this is an emergency conversation or situation, always call 911 because we never know. Like, yeah, we have Naloxone. If we use Naloxone, we should always call 911 no matter what. But even then, like, we don't know if we don't know for sure if it's an opioid overdose usually. And so another thing that looks similar to an opioid overdose is a diabetic coma. Those look similar to an opioid overdose. So the second step is react. So I come into the room, I see this individual, they have these recognizable signs. The second step is reacting. So first off, I'm gonna try to wake the person. We wanna make sure that they're not taking their Sunday afternoon nap and not just immediately inject them or give them Naloxone, otherwise they will wake up and they will not be happy with you. So make sure you wake that person up first. So try yelling, shaking, the sternal rub. Does anybody know what the sternal rub is?
I've seen people like this before, you know, like
Yeah, it's you want your knuckles. You want your knuckles on that it's the sternal rub. If you ever have that older brother that gives you the noogie on your head, it's the same on your chest. And if you've ever had it done, if you do it to yourself, it's not pleasant. And it's a way to cause the most amount of pain with the least amount of damage. So if they don't wake up with the sternal rub, something's wrong. So that's what it will look like. You'll go right in the center of their chest. And if they don't wake up, again, call 911 because no matter what it is, if they're not waking up, we need help. So first step was recognize. Second step is
React.
so the third step, before we get into that, I wanted to talk a little bit about the Good Samaritan Law. So this protects people who report an overdose. So in the past, we had some situations where some friends were having a party. They had drugs present. Somebody overdosed, and everyone was scared to call 911 to get help. And so the situations that we'd have were people either dropping their friends off at the front of the hospital and then driving off, or they would have people call 911 and like leave the area. We never want to leave the person who is overdosing. So important. So if I was using with my friends, the Good Samaritan Law will protect me if I decide to call 911 for my friend, and I will not get in trouble. It won't protect me if there's a warrant out for my arrest for a different reason, but it will protect you for doing something good for a friend. So that's something that we really are trying to push out into the community. Everyone should know that. Everyone's protected no matter what. Okay, so the third step is reverse. So this is another law that I want to introduce again. So this is the Naloxone law. So this allows people, individuals, anyone to administer Naloxone without any legal liability. So let's say they didn't wake up. I'm not positive it's an overdose, but I think it might be. I have a kit available. I can administer, if I'm in good conscience, administering Naloxone to somebody who I think is overdosing, I will not get in trouble for that. I say that also saying there are no side effects to giving somebody Naloxone. Like if you gave somebody Naloxone, other than withdrawal symptoms from the opioid, if they weren't taking opioids, there shouldn't be any harm in giving somebody Naloxone. If someone gave me Naloxone right now, it wouldn't change anything. I would be fine. So again, going back to what Bonnie said, there's no chance of abusing Naloxone. You can't get a high from it. There's nothing that Naloxone does except for reversing an overdose from opioids. And I want to make that clear too. Naloxone only reverses opioid overdoses. Okay, so warning, needles. Sorry about that. We're going to pull out some needles. So if you are queasy, I'm not offended. Please take care of yourself. And I will show you this first kit. So this is the intramuscular kit, and this is the kit that our library staff have here. And I'm just gonna go over some things in this kit. So first off, all opioid, or all Naloxone kits have 2 doses of Naloxone, always. They're about the same amount, I think it's 5 milligrams. Let's look and see. So each kit comes with 2 syringes and 2 of these vials, so 0.4 milligrams. So this is 1 dose of Naloxone. So when I'm using this kit, I see my friend or whoever it is, they're not, again, we recognize the signs, we try to wake them up, call 911. The next step is reversing. So I'm gonna pull out my Naloxone kit, and it has these two syringes. I'm gonna pull out the syringe. I'm not really going to do this, but we can use our imagination here.
Come on,
And
give
then-
me the Naloxone.
Yeah, who wants me to practice on them? We'll all practice on each other. We haven't, I'm just kidding, that would be terrible. And so when we're ready, we're gonna pop this cap. And so this cap, as soon as you pop it, you're using this or you're throwing it away. There's no popping the cap and then, oh, it's not an over, I'll just put it back and save it. Once this cap is off, it just increases the time frame of this going bad. So, or it doesn't necessarily go bad, it loses potency, I should say. And that's something with all of these kits too that I'll say. Naloxone, even though it has an expiration date, you can keep it past the expiration date. And it's not bad to use an expired kit on somebody. In fact, if you only have an expired kit, it's better to use something than nothing. And so this kit, so if this was expired, which actually it is, I would just go ahead and use it. I mean, if I had a new kit, obviously use that new kit, but use everything that you have available because, again, something is better than nothing. And it just loses potency over time. So it may not be as strong as a new kit, but it will do something. So I undid this, I pop this cap, tip it upside down, pull all the Naloxone out. It doesn't matter if there are bubbles. You're not trying to go into a vein or anything, you're just going into muscle because this is an intramuscular kit. So your muscles are going to be on the top, either the top arms, that like really the meaty places of the body, or the thighs, the areas with the most blood vessels. And you're going to inject in the side. The needle is fairly long. It's about this long, so it can go through a couple layers of clothing. You don't need to strip them down. So it will go through just fine, unless they're wearing like a winter coat or something. But in that case, you might want to take off the jacket and then give them that Naloxone. And so I would inject with my first kit. I honestly would wait maybe 20 seconds. I think in an emergency situation, seconds feel like hours. And so if they don't react quickly, I would just go and do the second dose. And so I'm gonna use up all of my Naloxone, whatever I have, until they wake up or until I run out, and then move on to the next step, which we'll talk about. So that's the intramuscular kit. Are there any questions for the intramuscular kit? Any questions online? Our online folks? Okay. All right. Okay, so with that, again, store it in room temperature. I don't think I'm forgetting anything. I'm gonna wake up in the middle of the night and be like, oh no, I forgot to tell them. Hopefully that's not the case. So there's that. Oh, I would say some people ask if you can inject like in the stomach or like heart. Some people are like Pulp Fiction. I don't know if you've seen that, but don't do that. That would cause harm. I don't know if the naloxone law would protect you from putting it and doing it in the wrong places like that. So don't inject in the heart. Don't inject in the stomach. The stomach isn't necessarily. It's not. It won't be fatal to them. It just takes longer because there aren't as many blood vessels in that area, and so it would just take longer for it to work. So again, muscles are your best bet for your intramuscular kit. Okay, we will move on to the next one. Okay, so this is our Narcan nasal kit, and did I skip one?
No, you were just gonna do those two.
Oh yeah, okay. I do have other kits. I do have some other kits available. We talked about the kits that were very expensive. So this kit out of pocket is like, oh, what did we say? $25 to $50 out of pocket. It's one of the cheaper ones, and it's because there's a little bit of assembly required when you're using it. The Narcan nasal kit is going to be a little bit pricier. So that's around, last time I looked at it, it was $125 to $150 out of pocket. I know that we've looked into, they have coupons.
Yeah,
sometimes on
GoodRx.
ones.
If you look on GoodRx, the auto injector was the cheapest one.
Yeah, GoodRx has some good coupons. So if you're in that situation and need it, I would go that route, especially if you don't have insurance that will cover it, or paying out of pocket, or just come to us or Spanish Fork Library. Gonna keep saying that. Okay, so I do have some other kits, and I'll just show you just for kicks and giggles because we have them. But this is the kit that is pretty expensive, and we don't usually recommend this kit to our community members just because it's so expensive. It's upwards of $4,000. So get yourself like I don't know, what can you get with $4,000?
A used car.
A used car
So if
or a nice
If
TV.
they will talk about Sam, why is that so expensive compared to the cheap one?
This one, so two things to answer that question. Why is it so expensive? So this is an example of when we see the need for something go up and that need get a little bit exploited by businesses. So there's that side of things, and then there's also this is an auto injector, and so if you've ever had an EpiPen, it works very similarly to an EpiPen. So it's really easy to use. It does itself. In fact, I'll just show you now. This is a trainer, and so every Evzio kit comes with a trainer and then two auto injectors. So this is the trainer. It does not contain a needle. I'm gonna say that right now. But the trainer will talk you through. She has an automated voice. It's nice and soothing, and they'll have you practice with the trainer first, and then when the time comes, when the crisis comes, you're going to use the actual kit that has the needle. It doesn't have the automated voice, so don't wait for it to tell you what to do because it won't.
That's what I would have guessed. I
Yeah,
would have waited for.
I know, that's what people are like, I'm in this crisis, we're gonna use it, tell me what to do, and they'll just be waiting. Don't wait for Evzio to tell you what to do, she'll leave you hanging. So practice with the trainer first, and I'll just let her do her thing.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
So
This
yeah,
trainer may be
She's
reused
fancy.
for training purposes.
that's why she's expensive. So, but again, it's all the same naloxone. It works. I looked it up once. There are minute variations in how fast each one works. Like it's so small that
recommend one naloxone kit over another. It's just a matter of comfort and what you can afford. So that's FZO. She's expensive. And the other one that I'm not gonna go through is this is another nasal spray. So this is a needle. This has a needle. The intramuscular has those syringes. This has some assembly required. It's the other nasal kit. It comes with 3. There's assembly required. It's one of the cheaper ones you can get, which is why it's so cheap, because you have to put it all together yourself. So in emergency situations, this is kind of stressful to use. A lot of our EMS people use this, and so it's just they just pop the caps, twist in the back, and then press firmly into somebody's nose. This is the piece that goes through the nose. If you want me to go through it, I can, but if you
Are there 2 vials in that one?
all of them will have 2.
So when
2
this
doses.
says insert it and put half in each nostril, is it talking about 1 vial in
Yeah.
each nostril?
I mean, you can. It says that, but it's not. You don't have to put some in each nostril. So I'll just put this together.
Is there a difference on the nasal ones if someone's not breathing well?
Nope, you do not have to be breathing for the nasal ones to work. So if I was putting this together, so there's this little spongy part that goes in the nose. This is your naloxone vial. I'm gonna pop this cap when I'm ready to use. Again, once you pop the caps, you're saying that you're gonna use it. And then you pop the back of the syringe, and then you twist on firmly. And then when you're ready to use, you place that foamy end in their nostril. If there is anything in their nose, like maybe there's blood or a lot of snot, just do a nice courtesy wipe, maybe with their sleeve if you don't want to use yours, but just try to make it as clear as possible, and then press in firmly, and so that it mists. And you can do it in each nostril. Like if you forget and you do it all in one nostril, like it will still go to the same place. It's all connected. And so when they say they want it to mist, they want it to look like this. Like you know like spray bottles. You've used spray bottles before. If you press in slowly, it kind of drizzles. And so when you're using this is just water. By the way, you don't want it to just drizzle, because then it's gonna run right back out of their nose. And so you want to spray so it mists, and then it's absorbed into the mucous membrane. Again, they don't need to be breathing for the nasal kits to work. So a lot of our first responders use this kit. Everything is twist on, which is, again, in my opinion, a little bit stressful when you're just trying to jam everything together. And you're like, why isn't it going together? So kudos to them and the work that they do. I think that they also have other kits that they can use too, but this is I was told that this was the most common one. So maybe it's changed at this point, but yeah, that is one of the more complicated kits. So the one that we have is not that complicated, and it's the Narcan nasal spray. And that's the one that we can give you today if you are interested. So again, every kit comes with the two doses of naloxone. So these come in their own packaging. They even have the instruction manual on the inside. And so when you're ready to use, again, you're looking at your friend or whoever it is, that loved one, make sure that their nose is clear as much as possible. And then when you're ready to use, you're gonna open up this packaging, and you're going to, this is an example one. You're going to place it so that your bottom fingers hit their lower nostril, and you're gonna press firmly. This one, there's no like halfway, you don't wanna halfway push in each nose. This one you're gonna press firmly. Once you press this in, the naloxone is gone, it's going to mist. So don't try to prime the pump. Again, once you press this in, the naloxone is gone. So make sure it's in the place where you want it before you press that in. And accidents happen, which is why we have 2 naloxone kits in each kit, or 2 devices in each kit. So, any questions with that one? That one's pretty simple. No assembly required. Again, all the same. It's just a matter of usability, what you feel comfortable with, and what you have available. Okay. So, we're on step 4, responding. Do we remember the first 3 steps? Bonnie, what's the first step?
Recognize.
Did you cheat?
Yes.
Yes, I wrote it down.
I saw you cheat. Yeah,
This
first
is
step.
not cheating, this is using my available resources.
Using available resources. That's why we have them. So yes, first step, recognize. Second step,
React.
react. Third step,
Reverse.
reverse. Actually using the naloxone. The fourth step is responding. So we've used all the naloxone that we have. Again, you can use as much as you can, as much as you have available. You can't overdose on naloxone. Let's say, so if I'm with my friend and they start breathing, I'm going to place them into recovery position. Recovery position, this has an example of what recovery position looks like. It looks complicated, and if that is overwhelming to you, just turn them on their side.
Yeah, I say just look at the bottom picture.
Yeah, look at the bottom picture. I mean, there's like a way they're like put whatever side you're turning them on. Like you put one arm up and the same leg up, and then you move them over, and their elbow's supposed to kind of prop them up a little bit so that they don't roll onto their face, but just roll them onto their side. And do we know why we roll them onto their side?
If they,
Yeah, exactly. We talked about withdrawal. So if they aspirate, vomit, throw up, whatever word you want to use, we don't want it to go right back down and then have a choking hazard on our hands as well. And so putting them over into that recovery position is important. Let's say they didn't wake up, or there weren't any noticeable signs that they were awake. So the second step is checking for breathing and a pulse. Are you CPR certified? Have you ever been CPR certified?
we put us through that.
First aid certified?
We have been.
Have been. So I'm not an instructor, so I can't technically teach this part, but there are lots of great YouTube videos. I wouldn't recommend the Office's version, but there are other great versions out there, and I know some hospitals have free classes as well. So this is where I put in the plug for those resources. But I will kind of go over it just briefly. So if we're checking for breathing and pulse. So if they are not breathing, then we're going to check for a pulse. If there is a pulse, this is the part. If you feel comfortable, if you know them and feel comfortable yourself, you can give rescue breaths. There's a very small window of time where maybe their breathing has stopped. We talked about how the opioids can shut down that central nervous system. There's a small window where their breathing has stopped, but their heartbeat is going. The thing that's going to keep their heartbeat going is that continued oxygen into their system. So if you feel comfortable, if you have a breathing mask available, that's an option. If you don't feel comfortable, you are protected. Like your safety is just as important as theirs. So only do it if you feel comfortable. And then if there is no breathing and there is not a pulse, that's when we give CPR. So again, I'm not going to go through CPR, but get CPR certified. It's awesome. It's great things. And so is that clear? But yeah, CPR certifications are great. So step 5 is refer. So this may not be a great time when your friend's maybe vomiting or agitated to talk to them about treatment, but a lot of the time there are friends and family around, and this might be a good time to talk about treatment options, or maybe later having those safe, like important conversations could be helpful, and helping them get to that treatment, because it's a big step. It's hard. It is hard making that step to treatment. So if you can be that safe person for that person, or know somebody who can talk to them about it, that's awesome. And then in your folders, there is that 211. You can either call 211, or there's an app available where you just put in your zip code and you can find addiction services near you. It's an awesome app. I've called it before. They were super helpful. They have a website, 211utah.org. It's all great. They also have, I think that they also link to SAMHSA resources as well. SAMHSA has a list of treatment resources on their website. Okay, and then we talked about where to get naloxone, and then this paper has how to prevent an overdose on there. There's also a pass-along card in there. It has the exact same information on it. So if you are talking with that person who maybe you use naloxone on and you're worried about them, or have a family member that you want to give them this card has the recognizable signs of an opioid overdose, and then where to get naloxone. And all of the resources on here are free usually, so check out those resources. It's us and Spanish Fork Library. Woo-hoo. Okay, and then the treatment on the back as well. So that 211 resource. Okay, now it's your turn. I'm done talking. We're just gonna review the steps really fast, make sure we hammer them in. We're almost done. So first step. What is your first step?
Just tell me the time.
Oh yeah.
And then,
Down here, can they see me down here?
yeah, and then if you want to just kind of, yeah, go
Okay.
ahead. Mm-hmm.
Perfect. Okay. I didn't want to block their view, but okay. Good. Okay. So first step. Shout it out. Recognize. Okay, so we have recognize. Recognize the signs of an overdose. What are some signs of an overdose?
Not breathing.
Not breathing.
Blue skin.
Blue skin.
Pinpoint
Cold
eyes.
clammy skin.
Pinpoint pupils.
Pinpoint pupils. Exactly. Stopped heartbeat, feeble heartbeat, death rattle, drugs present, all of those things. Second step. Dang it. React. How did you know?
I got that one.
Second step is reacting. So try to wake that person up. If they don't wake up, call 911. Make sure you can't wake them up before you call them. Or after, wait, what am I trying to say? Try to wake them up before you call 911. So make sure they're not taking that afternoon nap. Call 911 always. Just another side note on what Bonnie said, the way that it works in the brain. So opioids have a longer lifespan than naloxone, which is why people can overdose. So that naloxone will bind to those pain receptors in their brain, and the opioids fill that and block it so that no pain comes to the brain. So they work really well. But then when the naloxone comes in, it kicks that opioid off and sets in that pain receptor. And then when that naloxone fades away, the opioids can still be swarming around in that brain, and they can rebind to those pain receptors, which is why it's always important to call 911, because there's a chance of re-overdosing. Third step. Reverse. So actually using naloxone. So I recognize my friend. I tried to wake them up. They didn't wake up. I call 911. And then I get my naloxone kit. I make sure whatever kit I'm using, let's say I use the nasal spray, I make sure that their nose is visible. I place it firmly, make sure that it's placed where I want it before I press in the pump, and then administer the naloxone. And then fourth step, responding. So we talked about CPR, and then the fifth step, refer to treatment if possible, if they are willing. And then that's it. So thank you all for being here. There is a post survey. If you fill filled out the poster, but if you wouldn't mind filling out the pre-test on the